Cause of COVID-19. The cause of COVID-19 is a virus called SARS-CoV-2. It is a member of the coronavirus family, which also includes other viruses like SARS-CoV and MERS-CoV. The virus is believed to have originated from animals, possibly bats, and was transmitted to humans, possibly through an intermediate animal host. The primary mode of transmission for COVID-19 is through respiratory droplets when an infected person coughs, sneezes, talks, or breathes out. The virus can also spread by touching surfaces or objects contaminated with the virus and then touching the face, particularly the mouth, nose, or eyes. Once the virus enters the body, it attaches to specific receptors on human cells, particularly those lining the respiratory system. This allows the virus to enter the cells and replicate, leading to the infection. The immune response of the body is triggered, and symptoms can appear within a few days to 2 weeks after exposure to the virus. It is important to note that COVID-19 can range from mild to severe, with some individuals experiencing no symptoms at all, asymptomatic cases, while others may develop severe respiratory symptoms, organ failure, or even death. Older adults and people with underlying health conditions or weakened immune systems are at a higher treatment of COVID-19. 1. Symptomatic treatment. This includes rest, staying hydrated, and taking over-the-counter pain and fever medications, under medical guidance, to alleviate symptoms such as fever, cough, and body aches. 2. Oxygen therapy. For individuals with severe symptoms of COVID-19, supplemental oxygen may be provided to help with breathing. 3. Antiviral medication. Some antiviral medications, such as remdesivir, may be used for hospitalized patients with severe COVID-19. 4. Anti-inflammatory drugs. In severe cases of COVID-19, where there is an excessive immune response, cytokine storm, corticosteroids like dexamethasone may be used to reduce inflammation. 5. Monoclonal antibody therapy. Monoclonal antibodies can be used to treat mild to moderate cases of COVID-19, especially for individuals at high risk of severe illness. 6. Vaccination. Vaccines have been developed and authorized for emergency use to prevent COVID-19. They have shown significant effectiveness in reducing the severity. How to prevent COVID-19. 1. Vaccination. Get vaccinated against COVID-19 as soon as you are eligible. Vaccines have been proven to be safe and effective in reducing the risk of severe illness and preventing transmission. 2. Wear a mask. Wear a mask that covers your nose and mouth in indoor public settings and in crowded outdoor settings, especially where social distancing is difficult to maintain. Use masks that conform to the guidelines provided by health authorities. 3. Practice good hand hygiene. Wash your hands with soap and water for at least 20 seconds, especially after being in public places, using the restroom, coughing, sneezing, or blowing your nose. If soap and water are not available, use hand sanitizer with at least 60% alcohol. 4. Maintain social distancing. Keep a distance of at least 1 meter, 3 feet, from others, especially in crowded places. 5. Avoid close contact with sick individuals. Stay away from people who are sick or exhibiting symptoms of respiratory illness. 6. Practice respiratory hygiene. Cover your mouth and nose with a tissue or your elbow when coughing or sneezing. 7. Stay home if you are feeling unwell. If you are experiencing symptoms such as fever, cough, or difficulty breathing, it is important to stay home and avoid close contact with others to prevent the potential spread of the virus. 8. Follow local guidelines and regulations. Stay updated on the latest guidelines and regulations put forth by your local health authorities and follow them accordingly. 9. Maintain good respiratory hygiene. Dispose of tissues properly. Avoid touching your face with unwashed hands, and clean and disinfect frequently touched objects and surfaces regularly. 10. Keep informed and rely on reputable sources. Stay informed about the latest information and guidance on COVID-19 from reputable sources such as the World Health Organization, WHO, Centers for Disease Control and Prevention, CDC, and your local health department. Remember that these preventive measures work best when used together. It is important to continue practicing these preventive measures even after vaccination to protect yourself and others.